Hi, my name is Becca Cohen, and I'm a fellow with the DHS HIV Primary Care Fellowship. The reason I chose a career as in HIV primary care is because I've always been driven to work with LGBTQ populations, and unfortunately HIV is still a really big issue in our communities. I was drawn to this fellowship both for the excellent clinical training and for the public health training opportunities as well, and the opportunity to do a project in my second year. The great things about this fellowship is the diversity of clinical settings that we get to train in. We work in county clinics, community clinics, in the emergency room, inpatient, and in the jail as well. Every site has something different to take home, and my experience with the UCLA Clinical Scholars Program has been really great. I've gotten to learn from some very excellent leaders in the healthcare field, also learn and collaborate with some of the other fellows in the program who are doing really interesting projects. My favorite clinical experience has been working in the LA County Jail, whether it's working with people who are newly diagnosed with HIV or people who've had the diagnosis for many years. I try to think of it as an opportunity to make what is probably most likely a negative experience for them being incarcerated into some sort of positive experience in terms of their access engagement in healthcare. In a lot of ways, this is one of the only times people do engage in care, and so I do feel it's a great opportunity to reach out to people who need medical care for their HIV. The most rewarding experiences working in the LA County Jail was when one of my patients, who I was caring for during his incarceration, he was a new diagnosis. After he got released, he actually showed up to his clinic appointment with me at the county clinic. It was a really great experience. When we work in the jail, one of our major goals is to engage people into care and link them for after release so that they stay engaged in care. And there are many challenges that go into that, and we're not always successful. And in the cases that we are, it's very rewarding to continue working with those patients. So I definitely am planning to stay in LA working in HIV care. I'm planning to work both clinically and on a public health level as well. One of the best parts of the fellowship has been the guidance and support I have received in working on my fellowship project. As a second-year fellow, we get to dedicate our time on a project of our choosing. We get to, work closely with our mentors, develop, implement, and present on a public health research project. We get to work at the National Clinical Scholars Program and improve our projects there as well. And so that's definitely been one of the unique aspects of this fellowship so far.